Hello, I'm Dr. Mark Colquitt.
I'm Dr. Rob Williams, and we are bariatric surgeons with Covenant Health and Premier Surgical Bariatrics. Together, we've helped thousands of patients like you lose literally tons of excess body weight.
We hope this presentation will help you better understand our bariatric program and the surgical process, and your weight loss options. Participating in an in-person or online seminar is required to start your bariatric surgery process.
After you complete the seminar and quiz, you will receive an email confirmation. A member of our team will call you to set up a consultation with one of our bariatric surgeons. If for some reason you do not receive a confirmation, please notify the call center at 865-541-4500.
We hope this presentation will answer many of your questions about bariatric surgery.
Welcome to the Bariatric program at Covenant Health. If you've struggled to lose weight in the past, we can help with non-surgical and surgical solutions for weight loss. Our program includes a multidisciplinary team of surgeons, bariatric certified nurses, an exercise physiologist, care coordinators, registered dietitians, a psychologist, your patient advocate, and you. Bariatric services are offered at Fort Sanders Regional Medical Center and Park West Medical Center. Both hospital programs are accredited by the Metabolic and Bariatric Surgery Accreditation and Quality Improvement Program. This means the programs meet rigorous national standards for bariatric surgery centers with a goal of advancing safe and high-quality care for bariatric surgery patients. We're glad you've made the first step toward improving your life. Before we review different types of bariatric surgery, let's learn more about obesity in general. Obesity is a disease affecting at least 35% of Americans. If you are obese, you may have unsuccessfully tried lifestyle modifications, diets, and even medication to lose weight. What causes obesity? It can be a combination of hormones, our modern fast food environment, and genetics. The number of obese Americans continues to increase, and it's estimated that by 2030, a staggering 50% of the population will be obese. Obesity is dangerous to your health. It is related to many serious health issues such as high blood pressure, diabetes, sleep apnea, acid reflux, arthritis, back pain, depression, and liver disease. Obesity also increases your risk of several cancers. Yo-yo dieting doesn't work because as you diet and exercise to reduce weight, your hormone levels and metabolism adjust to keep you at your body's set point. Set point is the weight range in which your body is programmed to function optimally. Your body will actually fight to maintain your set point weight. Body mass index, or BMI, is a formula that involves weight and height. If you do not know your BMI, you can use the BMI calculator at covenanthealth.com/bariatric-services. In addition to meeting the BMI requirements, you must also be at least 18 years old, be healthy enough for surgery, understand the surgery and the risks, be motivated to lose weight, have no ongoing drug or alcohol problems, and have no uncontrolled psychological conditions. Your bariatric team, which includes your surgeon, primary care physician, bariatric coordinator, psychologist, patient advocate, and staff members, must agree that you are a good candidate for surgery. Bariatric surgery has been shown to improve or resolve many obesity-related conditions. The majority of our patients see improvement in their diabetes, high blood pressure, and sleep apnea, as well as other issues after surgery. The bottom line is, weight loss surgery reverses many dangerous chronic diseases. It can improve your medical and emotional health, your quality of life, and help you live longer. Guidelines for weight loss surgery were established in 1991 by the National Institutes of Health, who says that for morbidly obese patients, surgery combined with behavior modification is the most reliable choice for maintaining long-term weight loss. Changes in the hormone ghrelin after bariatric surgery improve weight loss by increasing your energy expenditure, or calories burned, your feelings of fullness, and reducing your hunger and appetite. Bariatric surgery alters several gastrointestinal hormones that affect your rate of digestion and insulin levels, and some procedures alter your metabolic set point. Bariatric procedures are considered to be non-metabolic or metabolic. Non-metabolic surgeries are known as restrictive procedures, as they limit the amount of food you can eat. The only FDA-approved non-metabolic operation is the laparoscopic gastric band surgery. Non-metabolic surgeries do not impact your set point. Metabolic operations impact gastrointestinal hormones in a way that increase metabolism and decrease appetite, giving you a new set point. This reduces the likelihood of regaining over time. Metabolic procedures include laparoscopic sleeve gastrectomy, Roux-en-Y gastric bypass, and biliary pancreatic diversion with duodenal switch. Let's learn more about the different types of bariatric surgeries. The laparoscopic adjustable gastric band is a non-metabolic procedure. It is minimally invasive and reversible. An adjustable silicone band is placed around the top part of your stomach, dividing it into two parts. The band reduces the amount of food you can eat by making you feel full faster. The band has a tube that is attached to a port placed under your skin during surgery. During office visits, the band is tightened or loosened by injecting or removing saline through the port. One of the primary disadvantages of gastric band surgery is that the band can erode or slip. This surgery has the highest risk of weight regain as well as the highest rate of reoperation. For these reasons, our surgeons do not offer the adjustable gastric band surgery as an option for weight loss surgery. If you already have a gastric band in place, our surgeons can adjust or remove the band for you, or remove the band and perform a different weight loss procedure. The sleeve gastrectomy is a metabolic procedure and reduces the appetite hormone ghrelin. With this procedure, 80% of the stomach is removed, and a smaller stomach pouch remains. Patients feel full more quickly and eat less food. The sleeve gastrectomy is permanent and cannot be reversed. Advantages of the sleeve gastrectomy include significant rapid weight loss, good appetite control, and a low risk of regaining weight. It also resets your body's metabolic set point. Disadvantages are that there are few studies showing the long-term results of the sleeve. It is not reversible, it is less effective for a higher BMI, and can make acid reflux worse. With the Roux-en-Y gastric bypass, the stomach is divided to create a smaller gastric pouch. The small intestine is cut and reattached in a Y shape, bypassing most of the stomach and part of the small intestines. Digestive juices pass through the arm of the Y, allowing digestion to occur. Gastric bypass is a metabolic procedure, and patients have excellent resolution of obesity-related diseases like diabetes, hypertension, and sleep apnea. Other advantages of this surgery include rapid, substantial weight loss with a low risk of regaining weight. Because of the risk of vitamin and nutritional deficiencies, gastric bypass patients must take vitamin and mineral supplements for the rest of their lives. There is a high risk of developing stomach ulcers if you smoke or use anti-inflammatory pain relievers like ibuprofen. So both are off limits if you have gastric bypass surgery. Also, if you consume too much food, especially fat and sugar, you may experience a rapid emptying of the stomach into the small intestine called the dumping syndrome, which drives up your blood sugar levels and can cause you to feel faint and have diarrhea. Let's learn more about gastric bypass.
Gastric bypass, technically referred to as Roux-en-Y gastric bypass, is both a restrictive and malabsorptive procedure because it reduces the size of the stomach and decreases the absorption of calories in the small intestine. Your surgeon will use one of two methods for gastric bypass surgery. The open method requires an 8 to 10-inch incision in the abdomen. The laparoscopic method only requires several small keyhole incisions, through which your surgeon will pass a laparoscope and surgical tools. A laparoscope is a thin, lighted instrument that projects images of the surgery on a monitor in the operating room. During a Roux-en-Y gastric bypass procedure, your surgeon will use surgical staples to create a small compartment which will serve as your new stomach. This pouch will hold about 1 cup of food. The lower portion of the stomach continues to secrete digestive juices, but does not receive food. Next, your surgeon will cut the small intestine well beyond the stomach and bring one free end up and attach it to the pouch. He or she will then attach the other free end lower down on the small intestine, creating a Y shape. By bypassing the lower stomach and the first part of the small intestine, fewer calories will be absorbed as food passes through this new pathway.
The duodenal switch, also known as the biliary pancreatic diversion, is a more complex metabolic operation. It is a limited combination of the sleeve gastrectomy and small bowel bypass. 50% of the stomach is removed instead of 80%. The sleeve gastrectomy, an integral part of this surgery, serves to limit eating and appetite. Additionally, the intestinal changes will separate digestive juice from food for the majority of the small intestine. This results in an incomplete absorption of calories consumed and enhanced weight loss. The biliary pancreatic diversion has several advantages, such as high excess weight loss, excellent resolution of obesity-related disease like diabetes, and the lowest risk of weight regain. One disadvantage is serious nutritional problems for patients who don't get the extra protein needed with this procedure. Other disadvantages include a change in bowel movements, and patients must take vitamin and mineral supplements for the rest of their lives. Robotic surgery can be used to perform the sleeve gastrectomy, gastric bypass, and the duodenal switch biliary pancreatic diversion procedures. Instruments are inserted through tiny keyholes into the patient's abdomen, and the surgeon operates the instruments from a computer monitor console in the same room. Robotic surgery allows for greater visibility and flexibility for the surgeon, and a smaller incision and quicker recovery time for the patient. Your weight loss will vary depending on the type of bariatric surgery you have. On average, patients lose up to 85% of excess weight with the gastric bypass and duodenal switch biliary pancreatic diversion procedures and keep the weight off longer. Next are the gastric sleeve and adjustable band procedures with 50 to 60% of excess weight loss. Just as vital to your weight loss success, though, is your commitment to follow the program and attend support group meetings. After surgery, you can expect an improvement or resolution of comorbidities or obesity-related conditions such as diabetes, hypertension, sleep apnea, stress incontinence, acid reflux, and high cholesterol. When choosing bariatric surgery, experience matters. Our surgeons have more than 30 years of combined experience, helping more than 7,000 patients lose more than 350 tons of weight. We're excited to share with you some before and after photos of successful patients. Now that we know more about the different types of bariatric surgery and how it can help you lose weight and improve obesity-related conditions like diabetes and high blood pressure, let's discuss the process leading up to your surgery. The pre-surgery process normally takes 4 to 6 months for several reasons. First, you must participate in an in-person or online seminar like this one to learn about bariatric surgery. Next, we will verify your insurance benefits and coverage. Bariatric surgery is covered by many insurance companies. However, coverage amounts vary and will depend on your specific policy. We will review your insurance plan coverage and discuss your requirements and financial responsibility with you at your initial consultation appointment. Some commercial insurance plans cover bariatric surgery, and Medicare is accepted for gastric bypass, sleeve, and duodenal switch biliary pancreatic diversion procedures. Self-pay options are also available. Following your initial consultation with one of our bariatric surgeons and patient advocate, Fort Sanders Regional Medical Center patients will have a nutrition consultation at the Fort Sanders Weight Management and Nutrition Center and an exercise consultation at the Fort Sanders Health and Fitness Center. Our Park West Medical Center patients receive a nutrition and physical screening during their initial visit with the surgeon. All patients will be evaluated by a psychologist and undergo lab tests to receive clinical clearance for surgery. Before you have surgery, most insurance plans require 6 months of participation in a medically supervised weight loss program, like what is offered at Fort Sanders Weight Management and Nutrition Center. While most insurance plans allow prescription weight loss medications as part of this process, they will not accept programs like Weight Watchers and Nutrisystem in lieu of a medically supervised weight loss program. During this 6-month period, you'll work towards hitting your pre-surgery weight loss goal and attend classes and support groups that include topics like nutrition, emotional overeating, what to eat and drink after surgery, and what to expect in the hospital. The final steps before surgery are receiving your insurance authorization and scheduling your pre-surgery visit with our surgeon. You must understand the risks involved in weight loss surgery, research your options, and seriously commit to the program. Involving your family in the process will help ensure your success. After surgery, you will have follow-up visits with your surgeon for the first 18 months, and then yearly for the rest of your life. Attending monthly support groups is important in helping you follow the program and lose weight. Bariatric surgery is a tool, not a silver bullet. Your own motivation and commitment are the keys to success in losing weight and improving your health. Surgery is the shortest part of the weight loss process. Depending on your procedure, surgery may take less than an hour to more than 2 hours. But remember, what you do after surgery is the key to your success.
Congratulations. The seminar you just watched is your first step in Covenant Health's bariatric surgery process. Hopefully you learn more about the risk of obesity and your different options for surgical weight loss.
Next, you'll be asked to answer a series of questions about the information you learned during the online seminar. You must complete the quiz to complete the seminar process. We're excited that you've taken the first steps towards changing your life and health through weight loss surgery. We look forward to meeting you and working with you soon.